The respiratory system and the cardiovascular systems make adjustments in their response to both the intensity and the duration of exercise. As cardiac output rises, the blood flow to lungs that we call pulmonary perfusion increases. In addition, the oxygen diffusing capacity, which is a measure of the rate at which oxygen diffuses from the alveolar air into the blood, can increase threefold or more during maximal exercise because more pulmonary capillaries become maximally perfused. As a result, there's a greater surface area available for the diffusion of oxygen into the pulmonary blood capillaries. When muscles contract during exercise, they consume large amounts of oxygen and produce large amounts of CO2. So during vigorous exercise, consumption and breathing both increase dramatically. At the end of exercising, you have an abrupt decrease in breathing, and that's followed by a more gradual decline back to the resting level. So that initial decrease is due mainly to changes in the neural factors that stimulate an increase as you're exercising. So when movement slows or stops, the neural factors help to decrease dramatically that breathing rate. But the more gradual phase reflects the slower return of your blood chemistry levels and your temperature back to the rest state, because as you exercise, of course, oxygen levels are decreasing, your CO2 levels are increasing, your lactic acid is building up, and it takes a while to return those back to normal. As we age, skin cells lose a lot of their normal function. Airways and tissue of the respiratory tract, including the alveoli, lose elasticity and become rigid. Chest wall can also become very rigid. The result is a decrease in lung capacity. The vital capacity, which is the maximum amount of air that can be exhaled after a maximal inhalation, can decrease as much as 35% by the time a person reaches about 70 years of age. A decrease in blood levels of oxygen, decreased activity of alveolar macrophages, and diminished or decreased cilia in the epithelial lining of the respiratory tract can occur. Because these are age-related factors, the elderly are much more susceptible to pneumonia, bronchitis, emphysema, and pulmonary diseases and disorders. These age-related changes in the structure and function of the lungs can also contribute to an older person's reduced ability to be able to perform a lot of vigorous exercises such as running.